Good morning, everybody. Thank you for joining us. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take a few moments to click buttons to make sure that all of you have permission to record. As always, you'll have permission to record this briefing, and we will also be recording and posting a link to the Health District's website and YouTube channel later this afternoon. So give me just one moment. Okay, I believe I've given everybody permission to record, but if you have any issues, please go ahead and send a note to me in the chat box and I will get that taken care of. We're joined this morning with Snohomish Health District Health Officer, Dr. Chris Spitters, Snohomish County Department of Emergency Management, Jason Biermann, and Mike Fong, Chief Recovery and Resilience Officer for Snohomish County. After each of our speakers share their remarks, we will take questions using the chat feature. Please make sure to submit your questions to everyone so that all of our speakers can see. Thank you for joining us this morning. And with that, I'll turn it over to Dr. Spitters.
All right. Thank you, Heather. Good morning, everyone. Let's start with some COVID numbers for the day. Our 1 week case count for last week, ending Saturday, October 2, was 1,634 cases, off just a little bit from the 1,700 the prior week. So we're coming down a little bit, but not rapidly. That brought the 14-day case rate through Saturday, October 2, down to 394, just under 100,000, or excuse me, just under 400 per 100,000. Again, just a slight decrease over the previous week's rate. So a reminder, we remain in a high transmission category by the Centers for Disease Control and Prevention parameters, and there's no change in any of our recommendations or requirements related to COVID prevention. Looking forward, people are going to want to ask, well, where's it going? And I think only time will tell, time and our choices around those very prevention measures I mentioned, and also completing a vaccination effort that reaches a higher proportion of Snohomish County residents. Certainly the previous waves have come down in a similar fashion, and so maybe that's the case going into the fall and winter. But I do think it's worthwhile to keep in mind that modelers looking at this, whether we come down a little bit and plateau or a lot and then go back up, there's a general prediction that there would be another wave in December, absent I think a dramatic increase in our vaccine coverage and tight adherence to other prevention measures, especially masking in public and avoiding gatherings. This is particularly of concern with the forthcoming influenza season, certainly being of uncertain timing and magnitude. You'll recall we had a very light, basically no influenza season last winter because all of the social distancing and masking really prevented any influenza from being transmitted. Given the somewhat of the retreat from that higher level of restriction on activities, we do expect with people working, gathering, traveling, that we will see a flu season, and in sync with a COVID surge that could again throw hospitals back into a worse state than they were recently. And really they remain struggling, but they're coming off of the peak, and but we could go right back there or even beyond. So I'll come back around to influenza in a minute. But speaking to the healthcare system itself, as of yesterday, 77 Snohomish County hospital beds were occupied by COVID patients. That's about 10% of total beds. 15 of those were being ventilated mechanically, that is, had respiratory failure and were on a mechanical ventilator. Hospitals, both the ICUs and the general floors, are running at about 90% capacity. Ongoing staffing shortages in both acute care and long-term care remain the primary bottleneck in healthcare system capacity, but not the only challenge. Again, the forthcoming influenza season could again put us right back up there. And given that the coming influenza season is likely going to be worse than the past 2 years and will also be at risk for another COVID wave, getting vaccinated against both COVID, if you haven't done so, getting a booster for COVID if you are eligible, and also getting vaccinated against influenza right now will mitigate winter hospitalization surge, protect individual health, and help us as a society get through facing these two respiratory viruses. Remember, you can get influenza vaccine and COVID vaccination at the same time. They do not need to be staggered or delayed. Influenza vaccine is recommended for everyone 6 months of age and older, but it's especially recommended for older adults and for those with underlying medical conditions, which, much like COVID, place them at increased risk of hospitalization, severe disease, and death. Speaking of vaccinations, we hit two big milestones here in Snohomish County in the last few days. The 1 millionth dose was administered over the weekend in the county, giving us 490,000 fully vaccinated and another 42,000 partially vaccinated Snohomish County residents. Another milestone is that we reached 75% of eligible residents, that is individuals 12 years and up, having received at least one dose of vaccine. Again, we strongly recommend everyone who started completing their series. There's only about a 10% gap between those who have started and those who have completed. So most people have completed their initial series, but for those who haven't, we really strongly encourage you to get out and get that done. Snohomish County should be pleased and proud to have one of the highest vaccination rates in the state, but we still have far to go, even though these accomplishments are something to take stock in and celebrate. The fight's not over, and those of you who have not been vaccinated, we encourage you to join the 500,000 people who have done so without significant reactions, and it is a testament to the safety and efficacy of these vaccines. Recent vaccination progress: about 10,000 Snohomish County residents have been vaccinated per week over the last 2 months. That's split roughly 50-50 between those starting vaccination and those people getting a second mRNA dose. Let's talk about booster recommendations. Now, this applies to Pfizer only. Boosters for Moderna and Johnson & Johnson are still under consideration, likely forthcoming, but not right now. So for those who have had 2 doses of Pfizer, the following groups are eligible for a booster 6 months after that second dose was received. Long-term care residents, strongly recommended. 65 years and up, strongly recommended. Ages 50 to 64 with underlying medical conditions raising the risk for severe disease and hospitalization, strongly recommended. Ages 18 to 49 with underlying conditions may pursue that, and it's recommended. If they have any concerns or doubts, they should discuss the risks and benefits with their healthcare provider. High-risk occupations also recommended. These include folks like first responders, healthcare workers, educators, food and agriculture workers, manufacturing, corrections, postal workers, public transit, and grocery store workers. Last, circling back around to Moderna and J&J and using vaccines in younger individuals, the Food and Drug Administration's Advisory Committee on Vaccines and Related Biological Products is meeting later this month to address expansion of the emergency use authorization for Pfizer vaccine, going down to 5 to 11-year-olds to include them, as well as to look at authorization for using Moderna and Johnson & Johnson for boosters, presumably along similar lines that I just discussed, currently enacted for Pfizer. Speaking of boosters, next week we'll be transitioning the Ashway Park and Ride to be a testing and vaccination site. Beginning the afternoon of Wednesday, October 13, the site will be vaccination only on Wednesdays and Thursdays from 9 a.m. to 4 p.m. The site will be testing only on Fridays, Saturdays, and Sundays from 9 a.m. to 4 p.m. The vaccine available on site will primarily be Pfizer, but Moderna and J&J will be available as supplies allow. This is by appointment only at this time. You can go to our website, snohd.org/COVID vaccine to register, or you can call 425-339-5278, Monday through Friday, 8:30 to 4:30 p.m. Again, first, second, and booster doses will be available, as well as that third dose for severely, moderately to severely immunosuppressed individuals. Proof of vaccination and eligibility is required if getting a booster, so bring your vaccination card or your MyIR record with you. Another vaccination and testing location will be coming online soon once we've established the final plans to put it in place. Please stay tuned for more information there. So with that, I'll turn it over to our indispensable Director of Emergency Management, Jason Biermann. Jason.
Thanks, Dr. Spitters, and good morning, everyone. I want to provide a brief update on what we're doing from the county's Emergency Operations Center. We are still activated and have been now for over 580 days, beginning back in March 1st of 2020. We've operated continuously since then. We were able to take, to minimize the staffing, I won't say take a break, we're able to downsize quite a bit in the middle of the summer before the Delta variant arrived in earnest. But we've had folks who have been operating in the EOC continuously. And right now we're up to about 215 different people from 18 different agencies that have together worked about 83,000 hours coordinating the response and the support to the health district and our partners. Just to put that in context, it's a little over 2,000 work week, 40-hour work weeks. And I did the math quickly, and it's like 41 years of 50 work weeks. So lots of folks from a lot of different entities, the health district, the sheriff's office, our human services department, public works, our hospitals and others who have come in and helped us help the community. Our focus right now is supporting the health district's operations, the testing sites, the mass vaccination sites, their ongoing work. That's our primary focus. We also have folks assigned to do a more global look at some of the impacts and look forward at the potential for other variants. Some of the big issues of concern we have are the supply chain and things that have started to happen with the supply chain, things in particular that may affect our ability to provide personal protective equipment. We're also looking at contingency plans for our healthcare system. Dr. Spitters mentioned that the healthcare system is frankly a bit under siege with the amount of patients, the quantity and the number, and in the upcoming flu season. So a lot of contingency planning that is happening around how to help them maintain the healthcare system, both within the county and with our regional partners. We've also continued to do some of the other work that we started all the way back in March of 2020. We are continuing to provide personal protective equipment. The state initiated a program that provides a 90-day no-cost supply of PPE to some of the smaller entities, skilled nursing facilities, adult family homes, those types of facilities. And in the last several weeks, we processed about 100 requests for that support, and that's delivered about 1.6 million pieces of PPE to partners around the county. We've also cumulatively, between what we purchased, what the state has provided, and what our amazing residents donated, procured more than 21 million pieces of PPE since the start of the pandemic response. And I want to say in particular, that piece about the donations, our community donated over 4 million pieces of PPE to this effort that we've done to make sure that our healthcare providers, our fire and EMS providers, all those folks who are in closest contact with real or potential COVID patients, that they have the personal protective equipment they need. Dr. Spitters mentioned the vaccination efforts, which are still ongoing. We are excited that we've passed the 75% threshold. We are also looking at contingency plans as other groups become eligible, both younger children, the age 5 to 11, and also folks who are going to need booster shots. If there is support that we need to provide, we're ready to do that. Getting folks vaccinated has always been a central tenet of what we've been doing from the Operations Center. And it certainly was the charge of the vaccine task force, which at one point was operating 7 different mass vaccination sites throughout the county. Dr. Spitter said this, I'm going to reiterate, we do have more work to do. We still need folks to go out and get their shots. So please, if you've started your regimen, complete it. If you haven't started it, please start it. The last 2 things I'll mention are programs that we've also been running since the outset of the pandemic response, but we'll begin to transition to the longer term recovery efforts. One of those is Nourishing Neighborhoods. That's the program that provides food, and right now we're at more than 20,000 boxes of food at 25 different locations. That's food that's provided to our most at-risk and vulnerable neighborhoods in the community. That's done through an assessment of data that looks at things like socioeconomic data, transportation data, food deserts, access, all sorts of different data points we look at to identify these locations where we can bring food to folks who are least likely to be able to go even to a food bank and get that. And one of the great things about this program is part of what we provide them is locally purchased produce from our farmers right here in Snohomish County. The other program is childcare. We started early on providing childcare to our essential workers so that we could do our best or do our part to make sure that they could continue to go to work. As our economy has begun to reopen, some of that focus is now shifting from essential workers and it's becoming a greater need. So that program, along with Nourishing Neighborhoods, will begin to transition more to our human services programs. And that will be part of the overall recovery strategy that will be getting implemented as we go forward and as we look forward into the next several months and into the next years. So that's going to conclude my update from the EOC and what we're doing in response. And I'm going to use that to transition over to Michael Fong, who is our Chief Recovery and Resilience Officer for Snohomish County. So Mike, I'll turn it over to you.
Great. Thanks, Jason. Thank you, Dr. Spitters. It's good to join both of you today. I wanted to spend just a couple of minutes first introducing myself and giving a brief overview on some of the recovery efforts we have underway. As some of you already know, I was the Senior Deputy Mayor for the City of Seattle, helping lead response to COVID-19 for the city. But I'm very excited to be able to join Snohomish County because I really believe we have an opportunity to make significant and transformative investments to ensure that everyone in the county can fully recover from the pandemic. I'm going to give a quick update on a few highlights on our recovery work to date. And again, I reiterate the leadership and work from Director Biermann and Dr. Spitters as we continue to move ourselves through our crisis response efforts and hopefully be able to hold the space towards reopening and recovery concurrently at the same time. So a few updates. First, my team, we are starting to assemble the Office of Recovery and Resilience. The team is going to take the lead on all aspects of work associated with recovery and resilience, but I want to really emphasize we are going to be relying heavily on the work of other departments and city agencies, as well as our community partners, and work towards fully coordinating our efforts in response and our responsibilities. On Friday, we transmitted the latest American Rescue Plan Act spending proposal to the County Council. And I want to thank the Council for their consideration of the executive's spending package. As you'll recall, just a little bit of background here, the first wave of spending went toward urgent needs to ensure that there were no breaks in critical services that were being stood up, many of which are focused in on services that Jason talked about that we are intending to look towards pivoting into the recovery space. And again, in way of background, just a reminder, Snohomish County is receiving a total of $160 million in American Rescue Plan Act resources. These are being reviewed and proposed in two tranches, if you will, two $80 million tranches. The first of which, as I mentioned, a first wave of spending that was approved by the council earlier this year was to continue critical services, roughly $15 and $16 million of investment. And the remainder of which, the 60+ million, is now part of the executive's proposal that is in the council's hands for review. And some of the highlights from that proposal: public health spending. There is about $10 million in continued support for the Snohomish Health District to respond to COVID-19 through vaccination, contact tracing, and testing. Many of the efforts that Dr. Spitters covered this morning. Second is investments in community support. And these are efforts to begin moving us and bridging us towards recovery, particularly focused on impacted individuals and households. This will include major investments in the areas of childcare, housing, and behavioral health support to families across the county. And we'll have more details on those programs in the coming weeks and months. In addition, this will be an opportunity in this space for me to highlight a signature project that the executive has proposed, the One-Stop Carnegie Employment Support Services Center, to ensure that family-friendly cross-sector approach to assist low-income households who suffered negative economic impacts as a result of COVID. Next group of spending investments are related to economic and workforce recovery. These are primarily focused on supporting, retaining, and growing businesses throughout the county. And some early keystone investments here will include expanding access to broadband, as well as direct targeted support to small businesses, in particular as it relates to small business innovation, and then business resiliency for some of our larger employers. As part of this, we also have a proposal for rescue plan funding that we regard as a foundational investment. And again, we've talked a lot about making lasting impact in a few key areas, and also in the context of the recovery strategy is to focus in on tourism and the hospitality industry to help attract customers back to our region and to help sectors rebound through other strategies, including the completion of the Food and Farming Center at McCollum Park. This is to expand opportunities for our ag producers to connect with local consumers, but it also speaks directly to something Jason talked about in terms of food security and highlighting this is building on our resiliency into the future. And then finally, we have continuity of county operations, and ARPA resources will help us ensure that the basic county services will continue and essential services will continue to be provided to our residents. So I just want to touch on a few cross-cutting principles of our work. And I know the county executive has mentioned these previously, and I know that the county is in alignment on moving in this concerted effort. For us to build ground-up structures and programs, but while we do that, we want to be fully transparent. We want to ensure that the public has trust in how we are spending these federal dollars, but also allow us to better fulfill our reporting requirements to our funders. We're going to draw clear connections between our strategies and the investments that we're proposing and how they map directly back to recovery. We're going to ensure that there's no ambiguity about what we expect these dollars to accomplish and how we can track to those outcomes. And the executive has mentioned many times, we're focused on applying an equity lens to program design and to outcome monitoring. We've already had excellent engagement with our community partners, And we have some specifics as far as how we're going to apply this equity lens in the near future. And then I also want to emphasize that our intention is that we will rely on data to help drive our investment strategies. We've been reviewing economic indicators already with the support of our partners, but we want to build out these community indicators in such a way so that they can serve as a basis for developing a public-facing dashboard for recovery. This will be one of our key tools to measure our community's recovery from COVID-19. And I want to thank Dr. Spitters again. We've had some very good meetings with the Snohomish Health District, and we'll look towards recovery in the context of how the pandemic begins to shift towards an endemic and COVID becoming a seasonal affliction similar to the flu. And this is important as we adapt as a community to the long-term health and economic sustainability for the region. And then finally, core principle here is that we're working together and we're leveraging the resources and partnerships of local jurisdictions and local mayors. And concurrently, right now, as we develop these programs, we're meeting with local mayors and their staff. We're scheduling working sessions over the next couple of weeks around homelessness, shelter strategies, and behavioral health. And we're hoping to build off of that great work that has already been done across the region. So with that, that's a very high-level summary. I appreciate the opportunity today to chat with you, and we'll have more to say as these proposals unfold. Thank you.
Great, thank you. We'll take some questions in the chat box. Dr. Spitters, the first one's for you about DOH's statement on a King County woman with the blood clot after a J&J vaccine. Do you think that will add concern for people getting vaccinated?
Well, I hope not, but in some sense, how can news like this not be disturbing to any of us? It's a tragedy for her and her family. I don't think there's any words that can come from my mouth that will make that any better for the people that knew and loved her. But backing away from the individual tragedy, our duty in public health is to look at the macro view. And clearly, when this syndrome that killed her related to the vaccination, it's a disruption in the normal functioning of the clotting system, and it led to her death. And this has been reported in a handful of other cases around the country. And when that first became noted many months ago, I think it was back in the late spring or early summer, you'll recall there was a pause on use of the vaccine, and the FDA and CDC reviewed all the data. And just summarize what we know with any medical intervention. That is, even the best medical interventions carry some risk, and but the overwhelming benefits led these regulatory agencies and public health officials to resume use of the vaccine and recommend its use, even in women in this age group. And part of that data, just as an example, was that if you administer 1 million vaccine doses of Johnson & Johnson to women in this woman's age group, basically women of reproductive age, you'll prevent about 260 hospitalizations, about 60 ICU admissions, half a dozen deaths, and you'll, in exchange, have to accept about half a dozen cases of this syndrome. Not all, usually it's not a fatal condition, although it's very serious, it is treatable. And so with that, with the public health lens and listening to everything I've been telling you, and the 600,000 lives that have been lost in the United States, the overwhelming disruption of the healthcare system, education, and the economy, despite this sad event and a handful of other ones like it, we have to forge on as a society and take the route that carries the most benefit, the best benefit to risk ratio. And so at that point, moving ahead with vaccination of all types, including this one, is where we're at. And none of that lessens the burden of this event on this woman and her family. And I'm sorry for that, but it doesn't shake our faith in the vaccines and the overwhelmingly positive impact, despite these side effects, the overwhelming positive impact on trying to restore some sense of normalcy and get back to life in this country and in this world.
Great, thank you. Next question, how are we doing in terms of cases or outbreaks in schools?
Well, high transmission rates in the community. Kids are back in school. Kids get COVID. And so we are seeing cases coming up in schools. I think the schools are doing a great job of implementing the prevention measures and working with us to report cases. Outbreaks, that is more, 2 or more cases that are connected in the school and by no other means. There are a handful of those. There's, I think right now there's only one that's larger than 5 cases, maybe a second one, but there's not a lot of outbreaks. We're certainly seeing cases because COVID's in the community. Largely it's being brought into the school rather than transmitted in the school based on what I'm seeing from our investigations so far. So again, it's an area where the benefits of educating kids, having them in school, allowing their parents to go about their daily activities, and implementing those layers of prevention measures among the kids, including vaccination of the staff, is the direction we've got to take to recover from this. And so that's where things are at.
Question, we're hearing that the J&J vaccine is being used as a reason people may continue to refuse to get vaccinated. Can you respond to that, considering the mandates that are now in effect?
Well, we have 3 flavors. If you're really concerned about the Johnson & Johnson vaccine and that is the barrier between you and getting vaccinated, choose another product. But they're all safe and effective. And again, safe is not an absolute term. The benefits of getting vaccinated are, overwhelmingly favor getting vaccinated, even despite the side effects, which are, these serious ones are extremely rare, much rarer than most serious adverse effects with other vaccines, which all of our children and all of us have received in the past. So, and the other side, it just, I've said, high benefit to risk, lots of hospitalization, ICU, and deaths prevented, many more than problems created by the vaccine. The risk of this very syndrome is greater from catching COVID than it is from being vaccinated. And for those of us who are at the younger end of the age spectrum thinking, well, I'm young, I'm strong, I'll get away with it. More likely to be true than someone my age or older, but 1/3 of hospitalizations in Snohomish County in August were in individuals under 50 years of age. Very few in children, but 20 to 49 years of age, there were about almost 50 hospitalizations due to COVID. So we're all at risk for severe outcomes, just less so at that younger age. But the benefit to risk is even favorable in those younger age groups. If a particular preparation is what's making you nervous about it, well, choose another.
All right. How much attrition will the health district see due to the vaccine mandate?
I can't say. We're first here's the current mandate that is in effect for the health district. All of our licensed healthcare workers and people that work in healthcare-like functions, although we're the health department, we have very limited clinical activity, but all the myself, all the nurses, everybody's vaccinated. As the president's directive for every employer with more than 100 employees, which includes us, to have full vaccination emerges and is implemented, I think we'll face the same small but real number of people who either for medical, religious, or philosophical reasons resist that. And then we will try to accommodate those who have bona fide, legitimate medical or sincerely held religious beliefs that support giving an exemption. And so our hope is to lose none. Despite threats of loss of employees, my understanding is that once timelines get close and people that don't qualify for an exemption are facing staying or going, most do choose to stay and get vaccinated.
Do we know vaccine rates amongst school employees?
No, if you add up the vaccines plus exemptions, it should equal 100%. But we're not privy to that data. I think you'd have to get that from the school districts themselves or from OSPI.
That looks to be all the questions that we've received this morning, so we'll go ahead and wrap up. I'd like to thank our speakers for joining us and sharing their comments. Please stay tuned for future media availabilities, and the link for this recording will be posted later today. Thanks and have a great day.